My name is Jennifer Calvin, and I'm the Clinical Operations Manager for St. Alphonsus Rehabilitation Services. When I work with spine patients, they've had chronic pain for years, many of them, and they've gone from doctor to doctor. They've been bounced around through the medical system. They've gone to physical therapists, but there's such a variety in what can be provided to the patient that I really feel that it takes an experienced therapist to bring together all of the options for that patient. A lot of it is hands-on and restoring function for that patient and giving them the tools at home to deal with their pain if they should have a flare-up. If a patient is experiencing symptoms such as weakness, numbness in one leg or the other, tingling or pain in one or both legs, if the pain doesn't resolve with rest, ice, or heat, if they're having pain at night, kind of a constant intense pain at night, if they've had a fall and they're having pain after a fall, any blow to their back or injury to their back, they should seek medical attention. Also, if they're having trouble urinating, if they've had a fever, unexplained weight loss, pain in their abdomen, all these are red flags that they should go and see their primary health care provider. I can match the patient's personality with the personality of the therapist that's going to be working with them to get the best benefit, the best outcome for their therapy. Because I really believe that the relationship that a patient has with their therapist is vital, so that the patient trusts their therapist and understands their therapist, and the communication is really good. It just makes your heart feel good when people get better. It's a wonderful career to be in.